Here the case is loaded and you can appreciate how different anatomy may look like in this particular patient, where we have a huge aorta, some prosthetic material of the ascending aorta, and we can also see that there is a prosthetic valve visible on the screen. So let's have a look at this patient now. I'm now pulling the probe back to the upper esophageal view. And I'm going down, and here you can see very strange image. Let's have a look closer. I'm going down slowly, and here you can see that there are plenty of different structures around, and also there is an aortic valve which can be visible if I rotate the plane to show it in short axis view. So most probably this is the mechanical aortic valve, which can be also visible in the X-plane view here. We can also see some artificial material on the mitral leaflet, which you may guess is the mitral clip. But moreover, we have to have a look at the aortic views. So I will go to 0 degree now, switch off the X-plane, and I'll go to the aortic views behind the heart. And here see, of course, in the real exam you cannot see the vertebral column, but this is just left here to show you where the aorta is located, what is the neighborhood of aorta. And here you can see that there is a huge descending aorta with the dissection, and we can see that there is flow which is different in the two lumina of the aorta, both in the short axis view and the long axis view. Saying briefly, the patient had acute myocardial infarction in the course of ascending aorta dissection type A, with the dissection propagating to the descending aorta. Patient underwent surgery. Aortic valve had to be replaced. Unfortunately, myocardial infarction created LV dysfunction, which then caused mitral regurgitation. So that's why the patient had afterwards mitral valve treated with the edge-to-edge technique. And here you see that there is a mitral clip implanted in the mitral valve. So very complex case, but as you can see, we can also train on this case how image like that may look like. And here in the color, you can see that there is just a little jet, narrow jet of the mitral regurgitation, and there are two orifice of the mitral valve, which we can see in the 3D imaging. And here is the 3D image of the mitral valve. I'm just increasing the gain, and I will zoom it in. And here you see the mitral orifice with the two clips implanted, and we see that the flow is happening through the orifice which are located on the sides of the valve. And here is the view from the LV side, without color, with color, explaining how the patient was treated.